Welcome to the TAG webinar, TAG in Action, the Rales Center for the Integration of Health and Education, supported by the U.S. Office of Adolescent Health. The Successful Strategies for Improving Adolescent Health webinar series is sponsored by the HHS Office of Adolescent Health. This webinar is one of a series highlighting local, state, and national efforts to improve adolescent health, and it is part of a national call to action called Adolescent Health, Think, Act, Grow, or TAG. My name is Evelyn Kapler. As the Director of the Office of Adolescent Health, or OAH, I'm very pleased to be with you to talk about TAG and to share information about a successful strategy to improve adolescent health. Our webinar today features the Ruth and Norman Rales Center for the Integration of Health and Education, based at the Johns Hopkins Children's Center at Johns Hopkins Medicine in Baltimore. It's an organization which truly embodies the essentials of the TAG effort. Since it was founded in 2014, the Rales Center has worked to incorporate components of a coordinated school health program around the tenets of a whole child approach to education. For this webinar, we're joined by Beth Marshall, the Wellness Program Lead for the Rales Center. Before I turn it over to Beth, I'd like to share a little bit about the Office of Adolescent Health and TAG. The Office of Adolescent Health is located in the U.S. Department of Health and Human Services. The office was first funded in 2010 and charged by Congress with developing a national plan for improving adolescent health. The office has used its limited resources and the input of experts to synthesize what we know about what works and to spur action in support of adolescent health. The TAG call to action is the first response to that charge. With this webinar, we're pleased to share an example of a program making it easier for young people to gain access to health care in educational settings. TAG identifies access to health care as one of 5 essentials for healthy adolescents. TAG builds on the collective work and insights of many professionals, researchers, and family members who know what it takes to promote the health and healthy development of America's 42 million adolescents. Teens are generally fairly healthy, yet there are many missed opportunities to promote adolescent health and to intervene promptly as health issues emerge in adolescence and young adulthood. TAG is a comprehensive-based, positive youth development approach to adolescent health rather than a risk-based approach. TAG is designed to help young people reach their full potential as healthy, productive adults. With TAG, we hope to spur action across multiple groups of professionals and organizations and in communities that all share a common interest in promoting adolescent health. Stakeholder engagement is a core tenet that drives all aspects of TAG and reflects our understanding that many determinants of adolescent health lie outside the healthcare system. The goals for TAG are the following: to raise awareness about the importance of adolescent health, to engage stakeholders, youth-serving organizations, and caring adults, to get adolescent health on the national agenda, and to spur action. Long-term, TAG contributes to achieving the Healthy People 2020 objectives for adolescent health developed by the United States Department of Health and Human Services. More details about TAG and the 5 essentials for healthy adolescents can be found on the Office of Adolescent Health website. Also, before we begin, I'd like to point out that the content and views of this next portion of the webcast do not necessarily represent the official policies of the Office of Adolescent Health or of HHS. I'm now pleased to turn things over to Beth to learn about the Rales Center's project to improve adolescent health. This project aims to improve access to health care for teens by better integrating health into educational settings. Beth?
Thank you so much, Evelyn, and thank you for having us here today to talk about the Rales Health Center. So I'm going to give sort of a big picture overview of how the Ruth and Norman Rales Center for the Integration of Health and Education came about, and then we'll talk specifically about the program. So the theory behind the Rales Center is really that health and educational outcomes are connected. And we've paid a lot of attention to how we can close the achievement gap for young people, and potentially not enough attention to the role that child health plays in closing that achievement gap. Generally, we look at education and we look at health in two silos, and we don't look at them together. But we know that healthier children are better learners. Across the field of adolescent health, we know that youth development tends to be siloed. We focus on the health of young people, we focus on the education of young people, and we focus on human services directed towards young people. But young people don't operate in those silos. They operate across them, and we have tried to integrate across those services as well. So the vision for the Ruth and Norman Rales Health Center is to improve the health and education and future productivity of children and adolescents, their families, and their communities. We really know that good health improves children's cognition, their attention, their social connectedness, and academic engagement, all of which makes them better learners. We also know that focusing on the education and the connectedness to schools and the engagement in academics then in turn makes them healthier young people. And we've tried to come at this from both angles. Our main partnership is operating in Kipp, Baltimore, which is not it is a charter school, but not a charter school that was founded on health and well-being as one of their core tenets. So Kipp is actually two public charter schools serving about 1,500 students. Kipp Harmony Academy serves students in grades K through 4. Kipp Ujima Village Academy serves students in grades 5 through 8. There's a strong college prep focus. In fact, all of the kids from kindergarten are in classes that are tied to colleges so that they learn from a very early age that college is their eventual goal. The population is about 83% free and reduced lunch. About 99% of the students are Black or African American, and we found that there's about 30% asthma prevalence in the school. We know that young people from Kipp are actually drawn from across Baltimore City, but the majority come from the neighborhood directly surrounding the school, which is the Southern Park Heights neighborhood. The neighborhood has a median household income of about $26,000 and has about a quarter of the students in both grades 1 through 5 and 6 through 8 who are chronically absent, being that they're missing 20 or more days of school per year. So there's a high need in the community and in this school, both for academic engagement and for health. So just a little bit of an overview of what our model looks like, and then I'll walk through some of these pieces in more detail. So Dr. Tina Chang and Sarah Johnson are the co-directors of the Rales Center for the Integration of Health and Education. We refer to our project at Kipp as the READY model, which is the Rales Educational and Health Advancement of Youth model at Kipp. So there are a couple components. We have the Rales Health Center, which incorporates school health services in the school-based health center, and mental health and family support. Often school-based health centers focus on one of these components, potentially an addition of mental health or the addition of school health services. But our model has reached out beyond that, and we have a parent engagement model and outreach, which I'll talk a little bit more about briefly. And we have a strong focus on wellness programming. We've also partnered with the University of Maryland to provide oral health services at Kipp. Since you did let everyone know that I'm the wellness lead, I am going to focus a bit on wellness. We have tried, and we feel like we are being successful in trying to incorporate the whole school, whole child, whole community model. This model builds on to the traditional coordinated health approach and the whole child framework by calling for a greater alignment and integration and collaboration between education and health. This model highlights exactly what we had set out to do at Kipp, and so we've tried to bring all pieces of this model to bear in this program. So I'm going to try and walk us through different components of the model as I walk through different components of the Rales model as well as the whole school, whole child model, so you can see how they align. So part of the whole school, whole child model is health services. The Rales Health Center is robust, expanded school health services. So we have a certified medical assistant and 2 school nurses who operate school health services. Then we also have a full-service school-based health center, which is staffed by a pediatric nurse practitioner, and then our medical director, who's a pediatrician. And then we also have a family advocate who helps with case management and resource linking. We do chronic disease management, we do acute care, we do preventive care. We have on-site labs, and then we also have prescription delivery directly to the health center. Theoretically, a young person who is enrolled in the health center could come in, have a test for strep. If the test comes back positive, which we can run the labs on site, we can then have the prescription medication delivered directly to the health center, so the young person is able to be treated immediately. So we're seeing over 75 observed medication visits daily. Our walk-in illness and injury visits are somewhere between 60 and 80 visits per day. And about 10% of those visits are then converted to the school-based health center to the pediatric nurse practitioner. We prioritize family, patient, and teacher education so we can continue that link with the school. We do a lot of chronic illness management. We prioritize communication with providers outside of the school-based health center so that we're ensuring a continuity of care for patients. We also partner with an outside provider who provides counseling, psychological, and social services. We do a lot of referrals to them, and we do a lot of screenings in response to what the school has requested. So another piece of the whole school, whole child, whole community model that we focus on is parent engagement. Sometimes parent engagement with a school-based health center can be for the sole purpose of enrollment. And I will not lie, enrollment is a big focus of our parent engagement efforts, but it goes beyond that as well. So we have a parent advisory group who advises on the school-based health center, and we are working with the school to integrate that advisory group into the school family council, so that group is giving advice and feedback beyond just the school-based health center, but more broadly to the operations of the school. That parent engagement efforts have helped us to achieve an enrollment rate of about 65%, and we're hoping this year to bring that enrollment over 70% for our school-based health center. We have set up Parent University, which is a series of talks that parents have requested and we've responded to, and those have covered things like mindfulness for parents. We've implemented the evidence-based Incredible Years with parents who have young children. We've coordinated talks on talking with your kids about the transition to adolescence, talking with your kids about sexuality and sexual behaviors. And we've partnered with the school on their Title I survey to ensure that we're asking questions of parents in terms of the programming they would like, not only academically, but also health-wise. So wellness, this is clearly my wheelhouse, and this covers a lot of different areas of the whole school, whole child, whole community framework. So we have, in addition to myself, a full-time on-site wellness director at Kipp who partners with the school across multiple areas covered in the WISC model. A lot of the work has been done with the school around school climate and the social and emotional learning at the school. So there's been a large focus on restorative practices and bringing restorative practices to the school. We've implemented, as you can see here, some mindfulness classes with students, as well as you can also see pictures of students who participated in some nutrition classes that were held. We try and incorporate families into the wellness programming. For instance, when we hosted a nutrition week for the school, there was programming in the classrooms during the day, and there was programming in the evenings for parents. We had a chef come in and hold nutrition classes with parents. And there was programming for teachers. We had a nutritionist on staff who could answer questions for any of the teachers during the day. We've had a great connection with the physical educators in the building so that we could work with them to incorporate fitnessgram screening across all of the grades in the school, as well as in-class physical activity breaks. And we've worked with them to supplement their health education for K through 4 and to push into some of the classes in grades 5 through 8 with additional health education topics that the schools requested. A big part of this program is to evaluate what we're doing with this whole school model. So as you can see here, we have educational and health outcomes across the trajectory from short-term to longer-term. So in the short term, we're looking at attendance. Can we return the kids right to class from the health center? Are we ensuring that all our kids are able to be in the classroom because the vaccination coverage is at 100% in the school? And we're looking short-term at how our health center is utilized, how are teachers and parents participating in wellness programs. But as we move forward in this model, our goal is to be looking at longer outcomes, both for education and for health, so grades and test scores, mental health service and utilization, the prevalence of uncontrolled chronic diseases. So I have a couple examples of areas that we've tackled through our partnership with Kipp, and I wanted to talk through them to give you a sense of how multiple areas of the school and multiple areas of the whole school, whole child, whole community framework are engaged here. So one of the things that we've tackled has been the social and emotional climate at the school, and this was really a request from the school. So we have supported a collaboration with the Positive Schools Center out of University of Maryland. And the school is a member of the School Climate Transformation Collaborative. Our wellness director sits on those committees at both the school and the district level and works to help the school in planning this transition to a positive school environment. Like I mentioned earlier, we implemented a year-long mindfulness class for both 5th and 6th graders, and we support the elementary school with their social-emotional learning curriculum. Prior to working with Kipp, we visited other schools around the country with a focus on trauma-informed practices so that we could bring that information back to Kipp and work to implement the pieces that make most sense in this environment. We've offered professional development to teachers on restorative practices and other topics around trauma and learning. We've worked with both the mental health providers in the school as well as the student support team and the teachers to track behavior referrals and ensure that referrals to mental health are being followed up on. We've offered professional development around trauma-focused cognitive behavioral therapy for the mental health practitioners at the school. And we are currently this year launching an initiative in partnership with a mental health provider to see if telemental health will improve the intake rate for students who are referred to mental health services. We have about a 10% prevalence of ADHD at the school, and we are, through the health center, we do initial evaluations, we do medication management, and we do medication administration for those students. So as you can see, it's a lot of moving parts and everyone coming together around a topic that's part of the whole school, whole child, whole community framework. Another area where we've moved outside of the traditional school-based health center is with asthma. As I noted earlier, according to the reports we get back from students in the beginning of the year, we have about a 30% prevalence for asthma. We were seeing incidents of uncontrolled asthma for students who hadn't reported that they were asthmatic. So we instituted a school-wide asthma screening, just 4 questions, and students would report on their symptoms. We had about half of the school report asthma-like symptoms. 21% were at high risk of uncontrolled asthma. And then we stratified the priority groups for follow-up, whether or not they were already identified, whether or not we had rescue medications on file in the health center, and if students had a high rate of absenteeism, so that we could include more young people in case management. We do directly observed controller therapy, and we do medication management, and the prescription delivery is very helpful with that. But we also set up self-management groups through the health center, and the nurses are leading those so students can better learn to manage their own symptoms. One of the other areas that we've moved beyond a traditional school-based health center programming is with our vision screening. The health department screens all students in grades kindergarten, 1st grade, and 8th grade, but the school asked us to include additional students. So we started out by screening, adding kids in grades 3 and 5, and students that the school identified as low readers. Overall, we found that about 51% of students fail the initial vision screenings. So we had on-site optometry services come and do follow-up screening, and then you can see we had different partners over different school years, but the partners would come in, do the additional screening, create glasses for the students that needed them, and then the students would be given 2 pairs of glasses, one for school and one for home. That cut down on students coming to school and saying, oh, I don't have my glasses and I can't see. Also, students, once they've lost a pair of glasses, generally cannot get a second pair within a calendar year. We're really excited about our partner with Adventure Vision because they were able to bill for those services, and so that makes it a more sustainable partnership. Another area that we have worked to include all different facets of school programming is around obesity prevention. We've worked with the food service staff around getting fruits and vegetables into the classrooms for students to try. We've worked with the education staff and brought in educational programming, Days of Taste, which is a connection with local farms where students actually visit the farms and create some recipes back at the school using local ingredients. Chef's Moves to School is a program modeled after Chef's Moves to School is a program where chefs come in and teach students, parents, and we also hosted one for teachers on how to cook different types of foods, whether it's vegetables or how to cook with low salt. we hosted a nutrition week, which had activities across the spectrum, both for students with health education lessons in the classroom, parents for activities in the evening, and teachers. We also, during Nutrition Week, set up a taste tester so that we could get healthier options sold in the school store at Kipp. We've been working with the administration to fine-tune recess planning and try to bring it in line with the CDC's new guidelines on recess. We've worked with content area teachers to bring physical activity breaks into the class using the Go Noodle platform. We've worked with the physical educators in the building to get FitnessGram screening across all grades and found that about 27% of our students are either overweight or obese. Those students can then be referred to school health services or school-based health center so that we can pick up students that they weren't already aware of. The nurses are leading self-management programs, both individual and the group level, and clinicians are able to manage students who need additional services. So as you can see, we have a large team covering both the health center, our administration and evaluation, our wellness programming, our parent engagement. We have students, both residents, undergraduate students, graduate level, both in School of Public Health and other departments who rotate through the center and help us with specific projects. I think it's important just to connect back to the overall tenets of TAG because this really resonates with what we feel like we're doing for our students and what we want for our students. Positive connections with supportive people is a thread through all of our work. When we first visited Kipp and thought about what was coming in the future, the teachers, the administrators, everyone said, you need to create a place where kids want to go. You need to have individuals who are going to be there to support young people. And our staff has done a bang-up job of doing that in the school. We're seeing over 75 visits a day at the health center, and we have students who are really just coming in because they need a hug or a pat on the back. We wanted to create a school-based health center that was a safe and secure place for students. But we knew we needed to move beyond those walls, and that's why we work so closely with the school around social and emotional learning climate at the school, because we want the entire building to be a safe and secure and engaging place for young people. We clearly are very focused on high-quality, teen-friendly health care. We are starting a student advisory committee for our school-based health center. We've had a parent advisory group since we started. We've had student engagement in particular projects, but we haven't had a student board over the entire center. And we've been working on that over the summer, and that will launch in the current year. We're also working to have student members on both the Wellness Council and the School Family Council at the school level, because I think it's really important to engage young people as team members, because they often have very different views of the services that we're offering or the services that are needed, and we lose touch with that if we don't engage them in the work that we're doing. Lastly, clearly from what I've said, coordination across multiple services is really important to us. We brought on a family advocate at the health center because we knew that there were times when families needed services that we can't directly provide on site. Our family advocate is well trained in resource connection and works closely with families who need services that extend beyond the ones that we can offer during the school day. So that is all I have to say.
Thanks, Beth, for sharing information about the Rales Center's efforts to improve health in schools. I'd like to take a few minutes now to ask you some additional questions. So can you tell us a little bit about what a successful activity you've implemented so far?
So that is a really hard question to answer. As you can tell, we've put a lot into place. And I think that, you know, if I was going to point out health programming, then I would point to our asthma or our vision programming. I think that, you know, extending beyond the walls of the school-based health center has been a huge accomplishment for us. And we've institutionalized those screenings that happen school-wide so that they continue every year. So that's been a huge success. The other thing that I think is really important is the relationships that we've built, in that the school will now ask us if we can provide them support on things that fall outside of a traditional health request. So they've learned to see us as a partner in the whole school. For instance, they've asked for help with analysis on how we can predict which reading tests might help predict performance on our state standardized tests. And that, to me, shows that they've really learned to see us as a resource beyond just health, which is our goal.
And what was the biggest obstacle to implementation that you've encountered in your work?
Well, it's slightly tied to the first answer. I think that even coming into a school setting and, you know, having everyone really have a core philosophy about the connection of health and education, it's sometimes hard, I think, for the educators to see us across both of those areas. I think, you know, we're used to operating in silos, and so the school, you know, was often used to operating in that silo as well. So ensuring that that the school saw us as a partner beyond just health services took some time and took some examples of things that we could do, for instance, the school-wide screenings or focusing on analysis that has to do solely with education or solely with student behavior, really helped them to see us more holistically.
And can you tell us a little bit about how this program is funded?
Sure. So the program started with a philanthropic gift from the Norman and Ruth Rales Family Foundation. In addition to that, that lovely group of people you saw on the team slide, we all work to secure additional funding for the school. So those can be small grants around, you know, for instance, getting the physical activity breaks into the classroom. We wrote a grant so that we could have that program accessible to all the teachers in the school. Or we wrote a grant to start a parent training academy so that parents got some training around advocacy, so that parents could advocate for their students' rights, students' well-being. And then the telemental health program that I talked about that we'll be instituting this coming school year, again, is through outside funding. So it started with a philanthropic gift. We've done a lot of continued fundraising through grant writing, and then a smaller portion does come from some reimbursement for billing for the school-based health center visits.
And my final question, if someone wanted to start a similar program in their own community, what tips would you have for them in order to be successful?
So I think one of the most important things, even given that it took us some time in building the relationships and building the school's ability to see us more holistically, was that we started out by talking to everyone in the school, every administrator, every teacher in the school, to find out. We actually use the whole school, whole child, whole community framework as a way to walk through with them what they saw as the strengths in their school and the opportunities for growth, and where they had priorities. So from the beginning, all of the work that we prioritized was really based on what we heard from the school administrators, teachers, parents. And I think that that's an important way to start a project when the expectation for the project is to be a collaboration over time.
On behalf of the Office of Adolescent Health, I want to thank you for joining us to learn about OAH and TAG and to hear about the wonderful work going on in Baltimore. A special thanks to Beth Marshall for sharing this program with us. The TAG effort continues, and we invite you to get involved and spread the word about TAG within your professional networks. And here are a few things you can do. You can explore our website. You can read and share the TAG playbook. You can join TAG and get email updates. I encourage you to watch and share the TAG Talks video with your colleagues. You can notify your colleagues and grantees about TAG, and you can encourage your organization to use TAG steps and resources. And then finally, you could use the TAG social media tools. Again, here are ways you can connect with the Office of Adolescent Health and with Adolescent Health Think, Act, Grow, or TAG. You can download free materials and sign up for e-updates on our website. We encourage you to send us your ideas and questions at tagteam@hs.gov, and you can follow us on Twitter at TeenHealthGov using hashtag tag42mil. Thank you for giving us the opportunity to share TAG and a great example of TAG in action with you today.